65-year-old man, originally from a rural community in the state of Hidalgo, Mexico. Farmer in complete primary school, married, Catholic, mother with gastric cancer disease, heavy smoking for 40 years at the rate of 15 cigarettes per day, social alcoholism, 2 beers per month. By external habitus, male, apparent age greater than chronological, average constitution, with a presence of a visible mass in the right hemithorax, algic attitude, characteristic facies, normal gait, not abnormal movements. This patient has have a movable mass in the right hemithorax, approximately 20 to 30 centimeters in diameter, painful on medium and deep palpation, with color changes in skin. Well, in this picture, we have the line time. They begins in April 2018. The movable mass in the right hemithorax with the characteristics in diameter 20 to 30 centimeters, painful on medium and deep palpations with color changes in skin and nipple. In December, in the same year, he goes to an appointment at the first level of care, is referred to the second level to be evaluated of surgery and oncological surgery and taken the biopsy. In January, for the next year, fine needle biopsy, the histopathological report of malignant phylloides. The malignant phylloides tumor candidate for neoadjuvant treatment and no adequate tolerance to neoadjuvant treatment. In February, the complications of lower respiratory tract. This patient has hospitalization in second level of care. This patient have anemia, require transfusion of packed erythrocyte, and the physician discharge forms maximum benefit to for home. And finally, in February, the patient dies. In this picture, we can see in the radiography this mass in the right chest, the mammography with a big mass, and what is the diagnosis of breast chest in men? A complete clinical history identification of risk factor is very important to identify these factors. History of radiation in the chest region, date of appearance of tumor, nipple retraction or color change, clinical examination of the breast, if there is a papal tumor of stony consistent, size of the tumor. The mammography with the BRADs results 4 or 5 suggestive of malignancy. magnetic resonance, target organs damage, evidence of metastasis. The ultrasound guide biopsy with fine or core needle, BRADS 4 or 5 breast ultrasound result. The histopathological report of the tumor size, histopathological type, histological grade. This is the gold standard to confirm the diagnosis of malignancy, of rule out the tumor. The hormone receptors, the estrogens or progesterone, the chest X-ray, the abdominal ultrasound, bone scintigraphy, and complete study of bone skeleton. And we have in this table the risk factors of development of breast cancer in men. Personal or family history of cancer, liver disease, Klinefelter syndrome, estrogen administration, ionizing radiation, gynecomastia, obesity, smoking, and alcoholism. The patient of this case have risk factor, personally or family history of cancer, smoking, and alcoholism. And here we have the in epidemiology, the sum of risk factors, alcohol, family history of cancer, and heavy smoking, rapid growth of breast tumor, malignant phyllodes tumor. In primary attention, we have critical links. And number 1, time factor. Number 2, healthcare opportunity. Number 3, diagnostic opportunity. Number 4, progression of disease due to phyllodes tumor in breast. Number 5, therapeutic opportunity. Sorry. And the discussion is the incident in this type of tumors. The patient present in this case study represents less than 1% of phylloid tumors of malignant origin in men. Signs that identify cases of this type of tumors are incident in women with a median age of 30 to 45 years. The classification, they are rare tumors among all breast tumors classified according to the World Health Organization as benign, borderline, and malignant based on histopathological characteristics such as stromal cellularity, excessive stromal growth, and the presence of malignant heterologous elements. And research there is an underreporting of these cases in the national and international literature, presenting a higher prevalence of these tumors in women. The conclusions: breast cancer is a complex entity subject to epidemiological surveillance. Breast cancer in male patients has a lower prevalence in diseases classified as breast cancer There are few cases in relation to the diagnosis in women. Phylloides tumors are rare tumors which present epithelial and mesenchymal components, have a behavior or recurrence of metastasis of this tumor itself. When these types of tumor occur in men, they are diagnosed late since the patient does not routinely go to the doctor's office and can be associated with another type of pathology in the mammary gland. Therefore, in early, timely, and accurate diagnosis can provide as a good prognosis for the patient as well as provide quality medical care and raise awareness about the preventive health care model. So that's all. Thanks to the organizers of the Global Meeting on Diabetes and Endocrinology, Dr. Giovanni Lopez Ortiz from Una Medical Magazine, to my job, IMSS Hidalgo, Mexico. And it's a phrase, sees that others do not see, what others decide not to see, out of fear, conformism, or laziness, see the world in a new way every day. Patch Adams. Thank you very much.
Thank you very much, Dr. Daisy, for this interesting case study. Any question from the audience?